Hello everyone. So this is INICET discussion of psychiatry MCQ. I have intentionally picked up this MCQ because this MCQ created a bit of a controversy, although this was a clinical but a simple question. I think some of you could manage it. For those who couldn't, please throw some attention because it's on an important topic. The question was, a 40-year-old male patient comes to the psychiatry OPD with complaints of having repetitive thoughts that he always feels hands are dirty, although they are not. He knows that these are his own thoughts only. This gives him discomfort and he has to wash them again and again. So from the history, it was almost clearly evident that we are talking about a disease called obsessive compulsive disorder. Where is the obsession here? The repetitive thoughts that are distressing, own thoughts, okay, discomforting, recurrent, intrusive, entering in his mind, and the patient doesn't want to have this thought, but he's compelled to wash the hands. Compelled to wash the hands. So there is compulsion. Now, obsession is a thought and compulsion is an act. We know that. Obsession is a thought, the thought that my hands are dirty, and compulsion is a motor act to counter that thought. The question was, this is a disorder of thought dash. So if we look at the thought disorders classification, this is what has been taught to you in the classes as well. There are four categories: form, content, possession and stream. Form, content, possession and stream. Okay. Now loss of association, that is derailment, synthesis, okay, night smooth thinking is a part of the form. Neologism is a part of the form. Circumstantiality and tangentiality in one book are given under form, and in one book it is given under stream. Now content include delusion and obsession. We have studied obsession under the disorders of content, delusion and obsession. That's why my answer to the question was content, C content. But some books have, some places it is given answer as possession, because one of the psychiatry books has given it under possession. But technically obsession is a disorder of content. What it contains: delusion, obsession, overvalued ideas, preoccupations, all these are part of content. Possession per se include thought insertion, thought withdrawal and thought broadcast. When other people get to know your thoughts or your thoughts are known to others. Okay, so that is it. Stream of thought include flight of ideas, increased speed, slowing of thinking, perseveration, giving the same answer to every question, and thought block. So that was stream of thought. So form, content, possession and stream. There are four standard textbooks of psychiatry. The first being Oxford Psychiatry Textbook, 4th edition, page number 32. Abnormality of the stream of thought, abnormality of the form of thought, and abnormality of the content of thought. Very clearly mentioned: preoccupation, delusion, overvalued ideas, obsessions. Okay. The second reference, our undergraduate textbook of psychiatry, Niraj Ahuja, page number 12. Content of thought include preoccupation, obsessions. Obsessions are ego alien, unwelcome for the ego, recurrent, irrational, intrusive, ego dystonic. Ego dystonic has been asked in previous AIIMS as well. And the third, last but not the least, but the most important, Kaplan textbook. Kaplan textbook says thought content is essentially what thoughts are occurring to the patient. Patient spontaneously expresses. They may focus on the material that is considered obsessive or compulsive. Some patient may ruminate or specific content or thought. And obsessional thoughts are unwelcome and repeated thoughts that intrude into the patient's consciousness. So all the three books, Kaplan, Oxford, as well as your Niraj Ahuja, give obsession under content of thought, and I believe that's a significant enough reference for you to support the answer as C, content of thought. And this is the classification. I want all students to remember this classification. Previously they have asked loosening of association is a disorder of, they have asked neologism is a disorder of. Some people say these are also delusions only. Actually there is one other classification in Kaplan which doesn't include possession at all. So they say delusion of thought insertion, delusion of thought broadcast. They are also technically false thoughts only, so they can be included in delusion. So this can also be content, but for the time being this is the classification which you need to remember. Look forward for more videos on INICET based discussion. There are many questions on psychiatry this time, so I'll be coming up with more videos. Thank you. That's all for this one. Thank you.